Now adjust your stethoscope so that you'll be listening through the diaphragm. When pressed firmly on the chest, the diaphragm is best for hearing relatively high-pitched sounds, such as S1, S2, the murmurs of aortic and mitral regurgitation, and pericardial friction rubs. Begin listening at the right second interspace close to the sternum. Note the cardiac rate and rhythm. Identify the first and second heart sounds and listen for extra heart sounds and murmurs.
If you take a good long listen to your heart, you'll actually notice that it makes sounds. And those sounds are usually described as lub-dub, lub-dub, lub-dub. And if you actually try to figure out what that would spell out like, usually it's something like L-U-B, D-U-B. And it just repeats over and over and over. And so to figure out where those sounds come from, what I did is I took that diagram of the heart that we've been using and actually exaggerated the valves, made them really, really clear to see in this picture. And we'll use those valves to kind of talk through where those sounds are coming from. So let's start by labeling our heart. So we've got at the top, blood is coming into the right atrium and going into the right ventricle. It goes off to the lungs, comes back into the left atrium, and then the left ventricle. Keep your eye on the valves, and we'll actually talk about them as the blood moves through. So let's start with blood going from the right atrium this way into the right ventricle. Now at the same moment that blood's actually going from the right atrium to the right ventricle, blood is actually also going from the left atrium to the left ventricle. And you might think, well, how's that possible? How can blood be in two places at one time? But now remember that blood is constantly moving through the heart. So in a previous cycle, you actually had some blood that was coming back from the lungs, and that's what's dumping into the left ventricle. And in a new cycle, you have a bit of blood that's going from the right atrium to the right ventricle.
Because diastole usually lasts longer than systole, you can identify the two sounds. 1, 2, 1, 2, 1, 2. You can hear S1 and S2 in the aortic area, in the right second interspace close to the sternum, pulmonic area in the left second interspace close to the sternum, left third interspace, tricuspid area in the left fourth and fifth interspaces, and mitral area at the apical impulse. The aortic and pulmonic areas together are sometimes called the base of the heart. Before auscultating the heart, let's review normal heart sounds. Closure of the heart valves creates a pair of audible heart sounds. The first sound, S1, accompanies mitral valve closure. The second sound, S2, accompanies aortic valve closure. Pulmonic and tricuspid valve closure may contribute to these sounds. Ventricular systole occurs between S1 and S2. Ventricular diastole occurs between S2 and the next S1. To improve your ability to hear S3, S4, and the murmur of mitral stenosis, have the patient roll partway onto his left side, which brings the left ventricle closer to the chest wall. Then recheck the position of the apical impulse and place the bell lightly on it. If the patient had an audible S3, it would sound like this. Have the patient sit up and lean forward. Then ask him to exhale completely and hold his breath out. Using the diaphragm of the stethoscope, listen at the left second interspace and down the left sternal border to the apex.
Breathe out completely again and hold it.
Pause periodically to allow the patient to breathe.